Hi, I'm Susanna. I'm an F2 at Dorset County Hospital. I'm originally from the United States, where I did my undergraduate training, and I did my medical training in Poland. I came to Dorchester just out of luck. I had chosen the Wessex area, and I couldn't be happier, to be honest. I've had 2 years here now, and it was such a supportive environment to start my training in. Everyone is very friendly, and Dorset is just so beautiful. The nature here is wonderful, and it's great to even just go outside for a lovely walk after work and see some sights and go to work and be around people who are supportive and create a really good learning environment and working environment. And I would recommend it to anyone who is an IMG who would like to start working in the NHS. I think it's a smaller hospital here, but it's a lot of friendly, familiar faces once you get used to it, and everyone is willing to help out and be encouraging. So it's a lovely place. I would recommend it.
Hello everybody, my name is Sasha and I'm from the beautiful island of Jamaica, located in the Caribbean. Currently, I am a GP trainee in the Wessex Deanery and I work at Dorset County Hospital. My experience thus far has been totally amazing. I feel well supported by the Deanery, my GP trainers, my seniors and my colleagues, and the working environment has been really good. Living in this part of the country has also been amazing because if you're a nature person like me, then you would like this part of the country. It's located close to beaches, you can go on your nature walks, and it has lots of activities to do, especially during the summer. It has been really relaxing for me. It allows for me to reset and recharge, and it has been really good for my mental health. I have attached some photos and some videos for you to see what it looks like to live in this part of the country. Hope you enjoy.
Hello, my name is Masri, and I'm from Egypt. I'm currently working as an SHO in Bournemouth Hospital. I've been living in this area for a few years now, working between Bournemouth and Poole Hospital. I think all hospitals will look the same in the inside, but what I love most about Wessex is that when you're not in the hospital doing your busy on call, you can be here. Yeah, so you saw it, and it's even better in the summer. So I'd recommend Wessex Deanery for working as well as living. It's a very nice place to be in.
Hi guys, my name is Suraya. I'm a GP trainee in the Portsmouth area. I am presently working on Hailing Island for my ST3 year. I am from Mauritius, and if you were to say hi in my language, that would be salut or bonjour. I have to say I have discovered this part of the country by sheer luck. 3 years ago, I had to choose to start training in a specialty I knew nothing of, in an area of the country I knew absolutely nothing of. 3 years down the line, I'm very pleased. I have to say yes to general practice, definitely yes to Wessex. Thumbs up for Portsmouth and double thumbs up for Hailing Island. We are a GP surgery about 5 minutes walk from a pebble beach with lovely views. We get to sit there and have our lunch. I know some trainers who choose to do the tutorial time by the beach. I think that's just fantastic. What's not to love? On another note, I have had a very difficult ST3 year. I have received a lot of support from the Deanery and felt very empowered. Thank you, Wessex. We're a young family and we are choosing to make Portsmouth our second home. If I had one thing to say, it would probably be kind and keep smiling always.
Hi, my name is Baiju Anjana. I'm one of the IMT trainees in Poole Hospital. I came to UK 2.5 years ago and I was working in London. That was in September 2018. And the main thing I moved from London to here was the weather. So when I came, it was very close to winter and it was really cold during December. So I looked through the map and I found that this was the place that had the best summers. So I applied for jobs in Wessex and I got a job in Bournemouth Hospital as an SHO. So I moved there and I had an amazing team in Bournemouth Hospital. There was even a team that called International Doctor Support Initiative, which helped international doctors to get into training and was really friendly as well. So I really enjoyed it. It was a smooth transition from being an SHO to being an IMT trainee, and now I'm in Poole Hospital and I'm really enjoying my training there as well. So Wessex is an absolutely amazing area. You have the sun, you have the beaches, you have the best summers and lovely, lovely people. Thank you.
Hello, my name is Gobi. I'm a GP trainee here in Portsmouth. I come from Sri Lanka and we say Vanakkam and Ayubowan. That's the greetings in the languages from my country. What I look forward in the future is traveling, seeing friends and family.
Assalamu alaikum. Hello everyone. I'm Hunfa Irfan from Dorchester. I'm GPST3 here. I'm basically from Pakistan. And it's a beautiful country. But I would like to describe the Wessex in few words as well. Wessex is a beautiful place, lovely people, and very supportive deanery. My motto in life is be kind to each other. It costs nothing but pays a huge reward. Hope you all are safe and fine. Allah Hafiz. Take care. Bye.
Bonjour, my name is James and I'm a Wessex GP trainee from Malta. And that was me saying hello in my language. I have been here for the past 18 months. After the lockdown, I look forward to exploring what this beautiful country has to offer. And I also look forward to going back to Malta and enjoying time with family and friends under the Mediterranean sun. Grazie Saha.
Assalamu alaikum everyone. My name is Mariam and I'm an international medical graduate from Pakistan. I'm currently working as an ST1 radiology trainee at the UHS. However, I have been working and living in the Wessex region for a few years. I think this is a beautiful place to live and offers great training opportunities in a wide range of specialities. The message I wanted to give to others today is that no matter what you do in life, if it's driven by growth and giving back to others, you will always be successful. Once this pandemic is over, I'm really looking forward to have my normal life back, visiting my friends and family. Thank you.
Assalamu alaikum. In just a kharaglas. Hello, my name is Pamir Ehsan. I'm originally from Afghanistan and I started to work for NHS in August 2016. My first job was in Southampton General Hospital where I worked as a foundation fellow. That was my first NHS experience and I would recommend to everyone if they can to start their first job in a hospital like Southampton, which I found very, very supportive. After a couple of years, I joined the National Training Program and I finished my core medical training in the Wessex Deanery. That was in another big hospital, Portsmouth Hospital. And I'm now working in Dorchester County Hospital as a cardiology registrar. Overall, the last 5 years have been very fruitful and I've learned a lot. I enjoyed working in all these hospitals. People have been very friendly, whether I was in training or not in training. I found a lot of support from everyone. And above all, Wessex is, I think, a region where you can do things when you're not at work. The weather is probably the better of it in the UK. You can find some sun, beaches are around. So definitely to all those who are thinking about working in the UK and joining NHS, I would recommend Wessex Deanery, whether that's for training or just transcript posts. Just a few hints for those who join NHS, who start their first job in NHS, is to try to take their first few months, find out what do they want to do, explore the specialties they think they would like, always ask around for tester weeks, ensure you document what you do. So that's the importance of portfolio. Wherever you go, make sure you're aware of the timelines of the different specialties when the applications open, and to work for them, because normally for the post starting in August, the application starts the year before in November time, and you normally need to provide a lot of evidence of competencies and things like that. So be aware of all these things, check with your colleagues, ask around. There's always a lot of help, but just make sure you go and you ask someone. Thanks.
Hello, my name is Chibuzo Okwoma. I am from Igbo tribe in Nigeria, West Africa. To say hello in my language is Ndewono. Kedotunu mere ekelela m unu niile. It means hello, how are you all? And I greet you all. I am a non-UK citizen, an international medical graduate. I graduated back home in Nigeria. I came to the UK about 15 months ago. I started in a trust grade position, and then later on I applied for training. Well, it was just, I had no particular preferences. I didn't know anywhere well enough, so I just sort of a lucky dip. But I did get this offer from the Isle of Wight NHS Trust, and I accepted it, and it's been nothing sort of amazing. I got here, started my training. Everyone at work, super amazing, super supportive. My supervisor, everyone is nice. They're eager to find out how you're doing, very friendly, helpful with work, just guiding me along. Just, it was super easy to find my feet. Just, I have moved around a lot in my career. I worked in several places. I was in London before I came here. It's just completely different. It's incomparable. You know, the reception was just great. The island itself, well, obviously super beautiful, beaches everywhere. There's so much to do: boating, sailing, the Needles, the Alum Bay, Gonad Bay, which is very close to me here. There's a sailing academy just the next street. So it's just for those who are interested. It's just super. It's a wonderful place to live in. The air is clean and fresh. My kids love it here. For nice families, I just cannot recommend it enough. It's a beautiful place. Also, the work has been very it has been flowing. Everyone is just, it's great to be here anyway. So one thing I would like to address is, when I was discussed with some of my colleagues, they were a bit skeptical about the quality of education on the island for some reason. However, having been here, I've had a great experience. Because of the pandemic, I'm not able to see homework, but my kids have great stories to tell. My 11-year-old tells me this is the best school she's ever been to. And we've moved around a lot, so she's been to quite a few. So that's great. I'm happy. They're all settled in. They are just well adjusted. They've made friends. Just because of COVID, there's not much moving, mingling and stuff, but they have settled in great. I think the island is just a beautiful place for living, for working, raising kids, just to be, for holidays, for those who come for holidays. I think it's just a lovely place. The deanery is very helpful, very supportive. Throughout COVID, they send meals, just make sure we're doing fine. Just a lot of feedback and support coming in. So I'll have to say I'm just very well adjusted. Well done, Isle of Wight NHS Trust. Thank you. Bye.
Hello, I'm Dr. Kampyo Wei, and I'm from Myanmar, and I have a background of cardiology. So currently, I'm working in Poole Hospital as an SHO, and yeah, the thing I love about Wessex is the weather. So it's a little bit warmer here comparing to the northern region, and it's brighter and sunny here. And the people here are lovely and kind. So I would like to recommend our new IMGs to join Wessex region. I think most of the IMGs are familiar with the hospitals in the northern region, but I would like to welcome all of the new IMG to join hospital in Wessex region. Thank you.
Hello, Hi everyone. My name is Lynn, Dr. Lynn Sanderline, acute internal medicine trainee registrar, and I'm currently doing my training in Southampton General Hospital. I started my first job in NHS nearly 4 years ago at Royal Bournemouth Hospital. I did my fellowship there in acute and general internal medicine, and their colleagues out there in Royal Bournemouth Hospital were very helpful and supportive. So I enjoyed working there and I learned a lot from my first job.
Magadi Hangwaneshangwari. That means hello friends and family in Shona, my native language from Zimbabwe. Hi, my name is Charles. I'm a GP registrar in Wessex. I'm very proud of my culture and my heritage and background, like many Africans. Over the last 10 years, I've also become part of a family that has made me very proud as well. And that's Wessex, as I've been a medical student and a trainee doctor since then. And I'm very proud to have been a part of it. So thank you very much. Bye.
Hello, my name is Lilia. I'm one of the GP trainees in Wessex. I'm from Nigeria, aka Niger, aka we know they carry last. If you see a Nigerian person, go say how far and they're going to love that. I'm from the Kalabari tribe in Nigeria and we say Toba. So I've been in Wessex for a while now and I must say it's absolutely the best decision I've ever made for my training. It ticked all the boxes of what I was looking for. Excellent sport, check. A safe place, check. Stunning location, check, check, check. And also as a plus to people with families, it's a great place to raise a family. They have good schools, so you're not going to regret coming to Wessex at all. And just a message to my fellow trainees, hope you're looking after yourselves, hope you're well, wish us the best, stay blessed and go Wessex.
Hello, my name is Stuart Purcell. I am a consultant psychiatrist and the Director of Medical Education in Dorset Healthcare. So I'm originally from a small town called Wight in South Africa, but I've been here working in the Wessex region since 1999. I've got three things I'd really like to share with you. Firstly, a huge welcome to those of you who've joined. I hope you're going to find this to be a place that is really enjoyable to live, to work and to train in. I want to say thank you to the nearly 2,000 trainees here in Wessex and to the many trainers and allied health professionals who make up our multidisciplinary teams, who overwhelmingly provide fantastic healthcare to our local community. And finally, I'm wanting to put the challenge to you to engage with the ABC of resilience. So autonomy, belonging, and competence. And it's my view that if you focus on the B's, the relatedness, if you can connect and you feel supported and you engage, your competencies will follow. So the final challenge, or another way to put this, is to sign up to the principle that we're going to treat each other at least as well as we aim to treat our patients. Welcome to Wessex. Bye-bye.